Hey, I'm Madeline Washington. I will be educating you all on the long-lasting benefits of at-home physical therapy for children with cerebral palsy. What is cerebral palsy? Cerebral means having to do with the brain, and palsy means having to do with the muscles. It is a group of disorders that affects a person's ability to move and maintain balance or posture. It is the most common motor disability in childhood. Cerebral palsy can be diagnosed within the first or second year of life. Cerebral palsy can look different in about each and every individual that has it. There's severe and there's mild. Severe cerebral palsy individuals may need help or assistance to walk, or they may not be able to walk at all. Or on the other hand, there's mild cerebral palsy individuals who have the ability to walk, however their gait may present a bit awkwardly. There are 4 types of cerebral palsy depending on which areas of the brain are affected. There's spastic cerebral palsy, which means that they have increased muscle tone, making muscles stiff and creating awkward movements. There's dyskinetic cerebral palsy, and that is problems controlling movements of their hands, arms, and feet, making it difficult to sit or walk. Ataxic cerebral palsy, they have problems with balance and coordination, which can cause an unsteady walk. Or there's mixed cerebral palsy, having more than one type of cerebral palsy. There are also different areas of the body that can be affected as well. There's monoplegia, which affects one limb, typically one arm. There's hemiplegia, which affects one side of the body, typically your right or your left side. It affects the leg, arm, and your trunk. Or there's diplegia, which affects symmetrical parts of the body, either both legs or both arms. Quadriplegia affects all 4 limbs, including your face and your trunk. These symptoms do not worsen over time. However, the exact symptoms can change over time. There are early intervention services available to help manage the symptoms of cerebral palsy. These early intervention services include speech, occupational, physical therapy, social services, educational services, nursing care, behavior modifications, nutritional counseling, family counseling, and or assistive technology. Of these services, physical therapy is considered one of the most important aspects of treating children with cerebral palsy. Through physical therapy, they restore, maintain, and promote optimal movement and physical function to overcome mobility, function, posture, and balance challenges. The ability to move and interact with other people and tasks is achieved by developing strength and flexibility. They can live a near normal life depending on the extremity of their cerebral palsy diagnosis. Physical therapy is often advised or begins after a pediatrician has determined cerebral palsy diagnosis, or they may notice some developmental delays and gross motor function and can prescribe or advise physical therapy. This diagnosis is often made before the child is 18 months old. What is physical therapy? Physical therapy is a rehabilitative health that targets large muscles by training and strengthening to maximize control and motor function of the body. A physical therapist is an expert in movements that improve the quality of life through exercise. They are licensed to identify mobility issues and limitations to create a plan that improves ability the ability to move and prevent the disability and promote healing. They assist patients with disability and aid them in education of machines necessary to live and how to live a better life with more mobility and less pain or injury. Physical therapy has a multitude of benefits. Regaining or developing physical activity is the utmost goal of physical therapists. Physical therapists treat problematic conditions in which they occur. These can include muscle atrophy or tightening, loss in range of motion, muscle spasticity, pain and inflammation, and contractures. Physical therapy for cerebral palsy is effective because it promotes the brain's ability to make changes based on actions. Neural pathways in the brain are constantly changing in response to motor activity. The more you perform an action, the stronger the neural pathways become. Therefore, it is important to consistently practice and work on exercises necessary to create and strengthen the same neural pathways If the action is neglected, and the neural pathways will weaken. Essentially, you can compare it to playing a sport. If you played softball in high school and you played all 4 years, you practiced all 4 years, but say you put the bat down once you graduated, you went on to college, gave it 4 more years, and then you decided to pick up a bat and play just a fun game of softball. Your performance is not going to be as strong as it was in your high school competitions because you've lost that ability and you've weakened your neural pathways. But along with the patient, the parent or caregiver also benefits. As the cerebral palsy patient progresses in their mobility and relationship and integration, reflex integration, relationships, daily life activities, etc. But as they progress, raising a cerebral palsy child becomes less labor intensive and your stress levels decrease. Caring for a person with cerebral palsy comes with a lot of responsibility, emotional distress. Not saying that it's not worth it, but it is very stressful. The more physical challenges the patient is able to overcome, the less hands-on assistance needed, decreasing the amount of extreme stress responsibilities. There have been a multitude of studies conducted to test the benefits of long-term physical therapy on cerebral palsy children. In this specific study that was conducted by Yi Need Chen and her colleagues between the years of 2008 and 2011, they evaluated the effect of long-term conventional physical therapy on cerebral palsy children to identify the predictors of therapy's response. The motor function was assessed every 3 months on 56 children ranging in ages 4 to 7 years old as an average. There's a significant improvement in gross motor function. The score measured 66. The score was different amongst the 5 levels of gross motor function classification system, with level 2 having the fastest progression. Younger cerebral palsy children also had better physical therapy efficacy, and the gross motor function score continued to improve from 66 until the ages of 8.5. The gross motor function classification system level 2 is where children walk in most settings and can climb stairs with the assistance of a handrail. However, they may experience trouble walking long distances, and aided assistance is needed, such as like a wheelchair or a scooter. Also, being in level 2, you only have the minimal ability to perform gross motor skills, such as running and jumping. Physical therapy can be conducted in an array of settings, such as the school, hospital, clinic, in and outpatient rehabilitation or specialized centers for therapies, as well as at home. However, at-home physical therapy is only for maximizing the effects of physical therapy in a licensed setting. Physical therapy needs to have an individualized plan that is created by the therapist. Physical therapy can be achieved at home before the clinic while a parent is waiting to be seen by a licensed therapist. However, continuing exercises you have looked up online and your own exercise regimen that you created is not going to have long-lasting effects and probably will not work as well. There's also not one universal therapeutic template for each and every cerebral palsy child because the diagnoses are different amongst each and every one. Therefore, they need to have a physical therapist prescribed exercise plan that can be completed at home and targets their individual needs. The physical therapist will teach either the individual with cerebral palsy or the caregiver on how to properly perform these said activities or exercises at home. Exercises targeted for cerebral palsy people are as follows: stretching, range of motion exercises, strengthening, constraint-induced movement therapy, gait training, aquatic therapy, and games or activities. Frequent stretching is a must for people with cerebral palsy to help stabilize muscle tone, prevent tightness, minimize the strain on the muscles and joints, and maintain full range of motion. This is needed because of the brain damage caused by cerebral palsy. The muscles The muscles can remain contracted frequently and involuntarily, which causes tightness and reduced range of motion. Practicing range of motion exercises actively will help strengthen neural connections and improve motor control overall. These exercises can include bicep curls, shoulder raises, leg and calf raises, ankle bends. Any exercise that's targeted at moving around a joint will help strengthen these neural connections. These exercises can also be increased in difficulty by using weights or resistance bands. Strengthening exercises increase muscles' power, flexibility, posture, and balance. There are a wide array of exercises, and these will be instructed by the therapist. Constraint-induced movement therapy is more beneficial for the ones that have one side affected by cerebral palsy. It involves restraining the use of the unaffected and allowing the affected side or limb to be used in the movements necessary. This will strengthen the neural pathways on the affected side, and these are easier to implement at home, especially if a brace is given to you. But using the brace, you can restrict the use of the non-affected side and encourage only the affected side to be used throughout the daily activities around the house. Gait training is a targeted walking practice that is used through speed and form. This is one that's not, if it's not corrected, it will cause and can create chronic pain, and other issues around the muscles in your knees and your hips, and cause neural problems as well. Orthotics are the main source of at-home gait training, and if one is recommended for your child, it is highly, highly, highly encouraged and recommended that you make sure this is being used as often as the therapist recommends and that it's not being neglected. Aquatic therapy is hard to maintain at home. However, if this is an option for you, it can be very, very beneficial. Being submerged in a pool will allow your child to feel weightless and it enables their body to focus on form without pain or strain. This is a good strengthening exercise. Games and activities is a way to encourage exercise and skills into daily living scenarios. A child's motivation at home, away from their physical therapist, can be slim to none. Having a fun way to encourage work is beneficial for the child's physical and mental health. The number one goal of physical therapy is to promote moving. Incorporating movement into a game or activity such as an obstacle course encourages movement, and some days that's all you need. Rest needs to also be focused on just as much as the exercise, because their bodies and muscles need time to rest and build. There are many tools for parents to utilize while working on physical therapy with their child at home. Motivation is hard, especially when attending therapy sessions and doing life outside of therapy. There are interactive home neuro rehabilitation devices that help individuals with cerebral palsy stay engaged to practice repetitive exercises. One example is the FitMe, which is shown right here. It's something that can connect to your computer. It's technology-based, kids love, but this device helps individuals stay engaged. It challenges them, which is really good, incorporating the games and activities. Everyone loves a good challenge. They try to reach a certain rep within a certain time, and this will allow the brain to stay focused and reach as many as they possibly can, keep them engaged, strengthen. This device can be customized to fit exactly your child's needs and ability level, so the challenge is the perfect amount and they're not overworked. Cerebral palsy requires constant stimulation to improve motor function, and this is what this device achieves. There are not many limitations to physical therapy. However, good communication is needed to ensure that the physical therapist is aware of all medical conditions as well as the patient's ability physically and mentally to achieve tasks and exercises. The main limitation is overworking. If good communication is in place, the therapist will know the limits of their patient and know when that enough is enough. Overworking is when the muscles are stressed too much and not enough rest is implemented. Repeatedly stressing your muscles without rest doesn't give your body enough time to repair the minor strains and injuries that naturally occur when you're training and practicing. This will lead to injury and pain. Overall, consistent movement and balanced rest-work schedules will significantly improve a child's life with cerebral palsy. Every child deserves a chance at a normal life, and encouraging the work in and out of therapy sessions should be a top priority. References to all the information presented is pasted right here. Thank y'all.